You're listening to the Dental Zone podcast. I'm Dr. Rachel Hall. This is the place that supports you to understand your dental issues, the causes and how to prevent them, empowering each individual to get the most out of life while bearing a stunning smile. Hello and welcome to the Dental Zone. I'm Dr. Rachel Hall, holistic dentist from Brisbane, Australia, and this is the podcast where we talk about things oral health, holistic dentistry, and how your overall health and dental health are linked, what you can do to improve your oral health and prevent yourself having dental problems as well as health problems going forward. If you would like to find out more, then you can hop on over to holisticdentistry.au or to my dental practice website, evolvedental.com.au. Today I want to talk to you about gum disease treatments and a thing that you may have heard of called deep cleaning or deep scaling. I want to talk about what that is, how it's done, why it's important, and what to expect. I mean, deep cleaning is something that we do a lot to help mitigate and switch off the inflammatory processes that damage your gums and can damage your health. So let's get to it. Let's get in the zone. So has your dentist ever told you or mentioned that you need to have a deep cleaning for your teeth? Well, if they do, then at least they're paying attention to your gum disease and the problems that are going on in your mouth that you will most often be quite unaware of, because the problem with a chronic illness or disease like gum disease is that it has slow progress, and that without understanding what the symptoms are, being able to know what to look for or to be able to test for yourself, then most people don't realize they've got a problem, because gum disease, like heart disease, is painless until you have the heart attack. Now, the heart attack with gum disease, and those two things are actually linked, the heart attack with gum disease is that by the time it's in its end stages, it's too late, and you start noticing that your teeth are getting loose or wobbly, or that maybe you're getting infections and swellings in your gums. By that point, you're in big trouble, and there's not much as the dentist that we can do for you. So a deep cleaning is an important treatment and procedure used to treat gum disease. It may leave you with a little bit of discomfort and tooth sensitivity afterwards, but it can help improve the health of your gums and the gum pocket depth significantly. So let's talk about this. Let's talk about what the procedure is, who needs it, why it's done, and what to expect. So what is a deep teeth cleaning? A deep teeth cleaning is called an SRP, or quadrant therapy in dentistry. So SRP stands for scaling and root planing. So what the heck is that? And how's that different to a regular cleaning? Well, a deep cleaning is a deeper clean, where we go in deeper under the gums than a regular cleaning. Now, in a regular cleaning, we are doing a maintenance clean. The mouth is essentially on the whole healthy, but has a buildup of plaque and tartar and biofilm, which is the microbiome, the bacteria that adhere to your teeth. And we go around and we clean that away. So we clean away the calculus or tartar, bacteria, and that bacterial layer contains dead bacteria, white blood cells, dead white blood cells, food products, and the substances that have stuck onto your teeth surfaces. So we remove that as an adjunct and a preventative measure to ensure that we're helping you to limit any effects of gum disease that you may have. It's a preventative treatment. Now, a deeper clean is a treatment for disease. This is where you have inflammation and your gums are actually being damaged by that inflammation, they are peeling away from your teeth and the bone is starting to get destroyed, and that leaves a gap that we call a pocket between your gum and your tooth and your root, where more and more bacteria can penetrate and nasty bacteria breed very easily, causing problems. So we remove from under the gum, deep down, the calculus, the tartar, and the plaque and the bacteria that we are getting in deeper under the surfaces to remove. Now, if we don't remove these products, gum disease or the immune response of the gums will get worse, and this will lead to bleeding gums and deeper gum pockets and more irreversible bone loss, bone damage, which will increasingly lead to a bigger risk of tooth loss and more bone loss around the teeth. Now, a deep teeth cleaning is literally a planing or a cleaning and scraping of the root surface, which is technically below the gum line. Now, there are two big reasons we do this. One is to help you keep your teeth for the rest of your life, and two, periodontal disease or advanced gum disease, where you are getting pocketing and bone loss, is linked to serious health issues like heart disease, strokes, dementia, Alzheimer's, and types of cancers. So it's not just about making your mouth healthy, it's about helping keep you healthy and helping to prevent you have these diseases. Also, if you have diabetes, it is harder to control your blood sugars if you have gum disease, and if your blood sugars are out of control, you get more gum disease, and therefore it's harder to control your sugars. You are also at higher risk of things like heart attack, and gum disease has been proven to be one of the causative factors for heart disease, cardiovascular disease, and Alzheimer's. So it's important that when your dentist or your hygienist advise that you need a deep clean, that you actually follow that advice and get the treatment done to save you having bigger problems going forward. So who needs the scaling and root planing? Now, some of the signs of gum disease are present before it gets identified and confirmed at a checkup. So you may be able to pick some of these things for yourself. Things like bad breath, bleeding gums, which you will find in gingivitis or stage 1 periodontitis. You can have inflamed, sensitive gum tissue, so it looks red and swollen. You might get tenderness when you're brushing and flossing. You may notice that your teeth are starting to drift or move slightly out of place. You may have a bad taste in your mouth as well. And if you notice any of these symptoms, then you should set up and book an appointment with your dentist right away. So here comes the plug. If you want to book with me and see me at my dental practice in Brisbane, then you can call us on 0737 201811 or our email info@evolvedental.com.au. So a deep scaling or root planing, this procedure is prescribed when the pockets, which are the gaps or spaces between your gums and your teeth, so not in between the teeth but down between the gum and the tooth itself, when those pockets are deeper than expected, and normally those pocket readings and measurements should be done annually and at regular appointments. So if your dentist or hygienist is not measuring the spaces between your gum and tooth and calling out lots of numbers during some of your checkups, they are not checking for this, and they are not diagnosing issues with your gums, and by the time they do, it's going to be too late. So if your dentist isn't doing pocket measurements, you want to either ask them why not and get them to start doing them, or find another dentist, because a dentist who does not do pocket measurements does not care about your gum health and does not care about your overall health, and therefore does not take it seriously and is not going to treat any problems appropriately because they're not even looking for them. So this deep cleaning, the scaling, the root planing or quadrant therapy, which means you've got really generalized, spread across wide areas of your mouth problems, and we treat this 1/4 of your mouth at a time. That's what quadrant therapy means that, we've got to take this seriously and it's got to be done. Anyway, what is it? It's done when those pockets are deeper than expected, which is the first sign of periodontal disease. And that means you're getting damage to the support structures of your teeth and gums. And this is beyond gingivitis, which is early stage gum disease, where you've got inflammation of the gums without bone damage. Deep cleaning is only done when pocket readings are taken at a pocket depth of more than 3 millimeters. So if we're doing those readings and you're hearing 4, 5, 6, 7, God help you, 8, 9, or 10, because those numbers mean you're in big trouble, then you should be having a deep cleaning done. It's a way of being able to really get into the crux of the problem and remove the bacteria and switch off the inflammation. We may have to take x-rays before root planing and scaling to be able to document and recognize the amount of bone loss, to look for any cysts or abscesses and infections around your teeth. As you continue to work to address gum disease, your periodontist, your gum specialist, or your hygienist or dentist may prescribe a regular deep dental cleanings like this, sometimes as often as every 3 months. Now, I would say that if you've got pockets 4 millimeters and bigger, you can't keep those clean on your own. You can't get in there with your brush and your floss to remove the buildup and stop buildup. And so any of my patients that have pockets greater than 4 or greater, we see them 3 monthly to do adjunct gum treatments, and not always doing a deep clean, but to make sure we're helping them keep on top of their mouth and on top of their chronic periodontal disease, so that we can help reduce their pocket depths and help switch off inflammation. And inflammation is one of the things that causes destruction in gum disease. Well, let's look at scaling and root planing versus normal teeth cleaning. If you have deep periodontal gum pockets with significant buildup, it takes more than just a regular cleaning to resolve that buildup and treat the disease. That's why the SRP, or the deep clean, is typically done by the quadrant and is a markedly longer procedure. There's more damage, there's more buildup, therefore it takes more time to treat. A normal tooth cleaning is we're just going around and we're tidying everything up. We're just helping you keep on top of things. So imagine you don't clean, or imagine you clean your house, but there's areas that you can't get to properly and you never get to them. And then like pulling the fridge out. So we pull the fridge out, and behind the fridge, it's absolutely filthy. It's going to take more than a quick cleanup to get that back on track. And that's kind of the closest analogy I can give you to help it make sense for you. The type of dental cleaning that we do for periodontitis is a bit more likely to cause some tooth sensitivity afterwards because of how we're having to get in and where we're having to treat. So to prepare for a deep teeth cleaning, there's not really much to do. What we do is we recommend that we get you to rinse with a very strong antiseptic mouthwash before we start. And this is because a lot of bacteria get transferred into your blood and out to your bloodstream during the root planing procedure. It's not because we're cutting into you or making you bleed, but because the gum tissues are so unhealthy that the blood vessels get more permeable and they bleed more easily. I don't like to use really strong mouthwashes on a regular basis because it disrupts the delicate oral microbiome, but I do like to use this just before we do a deep clean. And I also use antibacterial and antimicrobial products to flush out into those deeper pockets once we've done the deep clean, just to hit those bacteria very quickly on the head. But then to support you, I want you to use things like essential oils, oral probiotics, and a diet that's low in carbohydrate and low in sugar, so that we reduce and drive down inflammation. This helps prepare your immune system for the brief exposure to more bacteria, but it's also helping you make and take the first steps to halting gum disease. Now, if you're concerned about sensitivity or pain, you can use an over-the-counter pain reliever before the procedure, something like paracetamol or ibuprofen the night before and the morning of your procedure to get ahead of the inflammation. But I will normally do a deep cleaning with your mouth numb, or with numbing gels and numbing products inserted into the pockets, so that we mitigate and limit any sensitivity and discomfort during the process, and we can get the job done really well, really effectively, and really efficiently for you, so that we can really get on top of the gum disease. Now, what can you expect during an SRP, deep cleaning, quadrant therapy? It should take between, depending on the severity of your disease, anywhere between 1 to 4 hours. Now, I wouldn't do a 4-hour procedure all in one appointment, and that's why we do quadrants, and sometimes we'll do it in 2 quadrants. So we might do the right-hand side, upper and lower, and then come back a week later and do the left-hand side, upper and lower. If you've got really big pockets and a lot of build-ups, then we'll do it over 4 one-hour sessions. So first of all, we numb you by injecting a local anesthetic. We'll do, as I say, quadrant by quadrant, or half mouth, to do the proper scaling and root planing of all the surfaces in that area. The dentist, the hygienist, your periodontist will use tools such as dental scalers, so different shaped ones to get into different areas. We'll use an ultrasonic device with a vibrating tip to clear the plaque and calculus from above and below the gum design. We'll use basically what we're trying to do is remove all the build-up, and then we want to smooth and polish out any of the rough spots on the teeth so it's easier to keep things clean. We switch off inflammation, and we want the gums to heal and then retighten so that they're hugging tighter around your teeth, so that the gap between the gum and the tooth reduces and that the gum tissue returns to pink, healthy, disease-free. So does a deep teeth cleaning hurt? Well, yes, it will if we don't numb you first, and that's why we use the local anesthetic to numb your gums. Now, you may get post-operatively a little bit of sensitivity after the SRP, after the deep cleaning. Some patients can be very sore. There will be some throbbing and achiness, and even a regular teeth cleaning can cause a bit of pain, even though technically it shouldn't. But one of the things I want to explain is why you get sensitivity. It occurs for a couple of reasons. One is related to the health of the gum, and other is related to a very clean root surface. First of all, the gums are being pulled around by us during the procedure. We're treating chronic inflammation, and because of what we're doing, that switches on acute inflammation. Now, acute inflammation helps you heal, but as part of it, you get soreness and throbbing for a brief period of time afterwards. Because the root surface is much cleaner, you may get sensitivity. All that plaque and tartar and calculus on the root acts like a little thermal insulation barrier. So once it's gone, you may get some temperature sensitivity for a few weeks at worst, and you can help combat that by using a toothpaste containing hydroxyapatite like gem, and that prevents prolonged sensitivity. We can apply desensitizing gels and pastes within the practice as well if you're finding it's quite significant after treatment. So how are we going to take care of your gums afterwards? Well, after you've had the root planing done, you want to stay away from acidic drinks and foods for a few days. You want to make sure that you've got plenty of saliva in your mouth, because that helps remineralize and strengthen the root surfaces. You want to be drinking plenty of water so your mouth's not drying out. You want to use a hydroxyapatite toothpaste, as I've mentioned, and I will recommend you use a sonic electric toothbrush, which will gently help to break up the plaque before it hardens into tartar. I would also be using a water irrigation pick, and you can put in there some hydrogen peroxide to help oxygenate those areas and kill off the harmful bacteria and help the gums heal. Rinsing with hot salty water also helps heal those gums nice and quickly. But you want to just be really gentle with the gums and mouth for the first couple of days. Make sure you're cleaning best you can. Make sure that you're supporting your gum health. Now, there's other things that I will also recommend. That's things like high-dose vitamin C, zinc, not high dose, but high-dose vitamin C. And then along with that, zinc, vitamin D, because they help to improve your gum health. If you are low in iron or B vitamins, also important to supplement with those because they help heal and repair your gums. Some dentists are going to prescribe a course of antibiotics to prevent infection from the increased bacterial load. This seems to produce good treatment outcomes, but I don't think it's always necessary. And again, I would base that on you as the individual. Now, how much does this process cost? Well, you've got to understand you're having a lot of time in the chair. It's not just a quick or simple procedure. It's not a maintenance or preventive clean. Now, a typical cleaning, depending on where you live and your dentist, can range from $150, $250 up to $300-400 a quadrant. This means your deep teeth cleaning can range from, $600-700 to over $1,000 per treatment. And if more upgraded numbing agents or things are used, then these may also increase the cost. Some dental insurances, some dental health funds will cover that, but you'd need to look into that based on your own thing. Then to help maintain your gum health, you need to have 4 normal cleanings a year, known as periodontal maintenance. Otherwise, we do all that work, you don't keep it clean, and you're right back to square one, if not worse. So what happens if you don't get a deep clean, a quadrant therapy, or SRP when it's recommended? Well, it's vital to address your periodontitis as soon as it's been pointed out, which is just one reason that we recommend having regular cleans every 6 months, because it's important for your dental health. Well, it's not possible to reverse the damage from gum disease after it starts, like the actual bone loss itself. We can stop it in its tracks. Now, something like 50 to 70% of adults over 30 have some form of gum disease. So it's not a problem that we should be ignoring. Now, if you ignore gum disease and you don't treat it, you're going to get tooth loss from advancing bone loss. You're going to get increased risk of tooth decay. And then it's harder for us to treat the cavities because we haven't got healthy gums to protect the roots. You're going to get bone loss around the teeth. This is called the alveolar bone, and that's the bone that actually holds the teeth in. You're going to get painful receding gums. You're going to get infections, and you're going to get loose teeth that are more likely to drift and move, change your bite, and are more likely to fall out. You're also at risk of things like what we've talked about: heart disease, diabetes, strokes, cardiovascular disease, high blood pressure, cancer, Alzheimer's. Now, deep cleaning, it's hard to sell it and make it a fun procedure because it's not fun, but it is a necessity to stop periodontal disease. Now, the SRP, the deep cleaning, goes way beyond a standard cleaning where we just remove any plaque and tartar, smooth the clean surface, and off you go. This procedure goes way beyond that. We smooth and clean the surface of the roots. We go down underneath and beneath the inflamed gums, and we treat down in those deep pockets. It takes anywhere between 1 to 4 hours, and it's frequently broken into 2 visits. The roots of your teeth are going to be more sensitive. That shouldn't be lasting too long. And if you use your hydroxyapatite, then you should settle that down. So if you're told you've got gum disease, then take that seriously. Don't just keep fobbing it off and hoping it's going to go away and get better. Don't think you can just swoosh around with a bit of mouthwash and freshen up your breath and that's going to sort out any problems. Until we remove that hardened bacterial layer called tartar calculus in the profession, it's like having a dirty splinter stuck under your skin, and you're just washing your hands or cleansing that area and hoping it's going to get better. No, you've got to pull the splinter out so that the body can heal. And your mouth is no different. The bacteria, fungi, yeast, dead bacteria, dead cells from your white blood cells in there, the food products and breakdown, that all has to be cleaned away so that the inflammation in your gums, which is trying to fight the infection, gets reduced and switched off, and therefore your gums heal and we prevent your problems getting further. So if your dentist or your hygienist recommend a deep clean, then my advice is that you follow that recommendation. You get the deep cleaning done, you tackle gum disease early, and you prevent yourself having big problems. Now, if you've got pockets that are measuring 6 millimeters or deeper, it's not only hard for you to clean and maintain, it's harder for us to clean and maintain. And the chances of you keeping your teeth long term are greatly reduced. Then you must have your follow-up care, because if we don't maintain the health that we've been able to improve in your gums, you're just going to keep sliding backwards. You're going to get more inflammation. You're going to need more deep cleanings. You're going to lose more bone, and eventually we're just going to end up with you losing teeth and having problems that could have been prevented. Now, there's a lot of studies that show patients who have deep cleanings have improvements in markers like C-reactive protein. Now, C-reactive protein is something that is a marker of inflammation and a risk factor for heart disease. And when patients have had deep cleanings, that C-reactive protein level reduces and they get improvements in their overall health. So treating your gums, having those deep cleans, beneficial for your mouth and your teeth, but beneficial for your overall health as well. So I hope I've been able to shed some light on what a deep clean is for you today, what's involved, what to expect, and why it's so important. Now, as I mentioned earlier, your pocket depths, the measurements for your gum health should be done annually at minimum. And if your dentist and your hygienist are not doing that, they are doing you a disservice. They are not caring for you sufficiently enough, and I'm going to tell you that they don't care enough about your gum disease to help you prevent having a problem. So don't leave things too late. Get your regular checks. Make sure your dentist is doing your pocket measurements, and if they're not, find yourself a dentist or hygienist who is willing to do that on a regular basis, so you know exactly what's going on in your mouth, where you're at with your gum disease, and what the appropriate treatment is. And if you've got pockets 4 millimeters and deeper and your dentist isn't recommending deep cleaning, ask them why. Ask them why you're just going every 6 months for a regular scale and polish, a regular maintenance clean when you've got disease. If you've got disease, that needs to be treated properly and appropriately to help mitigate, switch off, and prevent that disease getting worse. Thank you very much for joining me. I'm Dr. Rachel Hall, holistic dentist from Brisbane, Australia. This is the Dental Zone podcast. If you want to know more, hop on over to holisticdentistry.au or evolvedental.com.au or give my clinic a call to book in and see me 0737 201811, and we will help you with your gum disease, your dental decay, amalgam removal, and anything that you want doing dentally to help improve your bite functionality, any cosmetic work, and we want you to have a healthy, beautiful smile for life. Until next time, thank you for joining me and stay in the zone. You've been listening to the Dental Zone podcast with Dr. Rachel Hall. For health, lifestyle, fitness, and a great smile, get in the zone.